Hello, Namaskar. I Dr. Rajesh Kumar Sharma, Professor and Head Department of Critical Care Nursing and Coordinator for Skill and Simulation Lab of Swami Rama Himalayan University. Today we are here to discuss the module of choking among the adults. How to relieve this choking when any adult suffers with the choking. Many times we have seen that some people who are keep on talking when they are taking food, especially in the restaurants, at home, when they have the parties, and sometimes some people, because no, they do not control their talks while they are taking the food, or especially when they take a hard food, like sometimes chewing this that like bones, what the non-vegetarians. So in that case, suddenly the food stuff while talking, it goes and gets stuck into the trachea, and in that case person is not able to take the breath. So if the person is not able to take breath, there are some sign of choking, some symptoms of the choking in the adults. So person is not able to speak also. He will have a difficulty in breathing, and or maybe he may have a noisy breathing, and patient will also not be able to cough also. He will try to cough with very force, but he will not. And then again patient's skin, lips, nails, which are getting turned in bluish or dusky. So in that case we have to identify the person that definitely he or she is getting choking. And there is a classical sign like that way. He will hold his neck with this both the hands like that way. It is the classical sign of the choking, and patient sometimes may lose the consciousness also. So please do not do the Heimlich maneuver on a person who can speak. So better if person is speaking, then there is no need of doing any procedure on that person. And when we are approaching to the client, we should always ask him, are you choking? If victim notes yes and cannot talk, it means patient is having severe airway obstruction is present. So take steps immediately to relieve the obstruction. Give abdominal thrust to a victim who is standing or sitting, or chest thrust for pregnant or obese victims. Repeat thrust until effective or the victim becomes unresponsive. So how to give the abdominal thrust is most important over here. First, lean the person forward slightly and stand behind him or her. Make a fist with one hand, as you can see in the picture. Put your arm around the person and grasp your fist with your other hand near the top of the stomach, just below the center of the rib cage, and then make a quick hard movement inward and upward. Always remember the position of standing back side of the client. Always put one leg between client leg to prevent fall of both client and rescuer. If you see the object in mouth, put a finger and remove it. If you are not able to see any object in the mouth, please do not put finger blindly, because it may lodge the object deeper in the respiratory tract. If person becomes unconscious, lay down on the flat surface and start CPR. If you are able to remove his object, or person is normal, then please refer him to the hospital and just for a observation. Now let's see in the video how to perform this choking among the adults. Oh, I think this fellow is having choking. Are you choking? Oh, it means he's not able to speak also. It means he's choking. So how to relieve it? We have to go to back side of the person. We have to hold his hands like this way, and after that we have to see the legs how we can. So we have to hold the patient like this way, and we have to this hand fist we have to like this, and on the above the navel and between the sternum and navel space, and with the second hand we have to hold like this way, and we have to put upwards. But before that we have to see that
my position is appropriate, because this is between his client's legs. I have to put my legs, and a second leg should be in this position. My feet should be like, because if the person becomes suddenly unresponsive, that he will be falling. So in that case, I should also not fall, and I should hold him. So by this way, he will come this way, and I will make him to lay down easily. Otherwise, it will be very difficult. So after that, I have to put this one above upwards. I have to put down this one. 1, 2, 3, 4, 5, 6. So after giving 5, this one abdomen thrust, if the client is able to swell it out, otherwise if he is not able to throw it out, in that case again we have to go another 5 abdomen thrust. So like that way we have to keep on doing unless until this object doesn't come outside. If the object is visible outside, open your mouth. So it is not visible. So in that case, I will not put my finger. If it is visible, then I put my finger and I will take it out. So if the person becomes unresponsive, in that case, I have to make him lay down and I have to start CPR. So this is how we have to do the management of choking in adults.
Okay, so you have seen in the video how we have done the hemorrhage maneuver for a adult person if the person is getting choked. So thank you so much for watching this module of choking among the adult and how to relieve it. Thank you.